Good morning. This is Mark Kenny with AMN Silversheet. Thank you for joining us today for our April webinar on payer enrollment. Joining me today is Hemanth Panya, our product owner. Thanks for joining, Hemanth. Can you hear me okay? I think you're muted.
Yep, I can hear you, Mark.
Okay, great. Yeah, appreciate it. And it looks like we have some attendees in. Just one slide regarding Teams. If you're new to Teams, you can use that control panel at the bottom of your screen to enter the chat, enter questions, things like that. Everyone should be in muted mode, so don't worry about any of us hearing you. Everyone's muted except the presenters today. So today we're going to get started and we'll discuss payer enrollment. So payer enrollment and network management are two of our AMN credentialing solutions offered through Silversheet. In addition, Silversheet offers traditional facility credentialing, appointment management, privileging, primary source verification and credentials and credentialing, expirables and sanctions management. And enrollment and network management fits into a unique piece of all this because traditionally our clients are doing credentialing for themselves, right? You, as a facility credentialer, you're credentialing your providers for your facility, your center, your hospital, et cetera. And payer enrollment introduces a new concept of external credentialing, meaning you're going to be enrolling your providers or some subset of your providers, like your employed providers, with some external entity like a payer, and represents its own unique challenges and variables. And this is really an introduction of network management and payer enrollment as it exists in Silversheet. We are continuing to develop heavily in this space. Hemanth will talk about that after the initial presentation and demo. And so just for those of you who are new to this area, what you see today will be enhanced quite a bit in the next few months. Things that you might not see, things that are behind the scenes, as well as user interface reporting and things that you'll use every day. So let's talk a little bit about payer enrollment. Sorry, I meant to have this slide up a little bit earlier. Just for those of you who don't know us, I'm Mark Kenny. I'm the Senior Account Executive for AMN Silversheet, and I'm joined by Hemanth Panyam, our Product Manager for this area, and will be the presenters today. So our agenda for today will be to discuss why payer enrollment matters, to review the enrollment workflow and dashboard, to review network management. This will be a live demo in our demo database, so you'll be looking at the same features and the same workflows that you would be using as a Silversheet client. And then we'll talk about the impact to your organization, and then Hemanth will update us on further development in enrollment, as well as the overall Silversheet product. Our time for our webinar today should be around 35 minutes, and there should be plenty of time to answer any questions you have. Just to reinforce or remind you to use the chat feature. We'd love to hear back from you. You can use your reactions, clapping, hands, all of that helps us as presenters, knowing if we're doing a good job presenting to you. So there'll also be a survey at the end sent out to you on what you thought of this webinar, as well as a recording and attachment of the PowerPoint slides themselves. So let's talk about why enrollment matters for just a moment. So for many of our Silversheet clients that have never really had to think about enrollment in the past, the providers were independent, they operated in their own group practices, and that may still be the case for many Silversheet clients. But what we're seeing is an intersection between facility credentialing and enrollment, and that occurs in a number of settings. What we're seeing is that some clients are taking on the responsibility to assist their providers with enrollment. And that has a direct effect on the facility's ability to bill for and collect on services that are provided through their health centers. Increasingly, additional or health centers, uh, hospitals, and health systems are increasingly employing the providers that provide the care. And so for those employed providers, often they're going to look to you as the manager for the enrollment experience. So doctors aren't going to want to do it themselves. They're going to be working through a medical group, some sponsoring organization, and looking for that organization to help them with the payer enrollment. So let's talk a little bit about, fundamentally how these two, facility credentialing and enrollment, these two functions operate. So we like to think of facility credentialing as allowing the provider to see patients and to treat them in our centers. And that, in by and large, is what facility credentialing does. Enrollment, provider enrollment, network management, delegated provider enrollment, non-delegated provider enrollment, you have all kinds of different terms, insurance credentialing, validation, all of those things are typically done with external agencies, external payers, external companies, networks, management companies, and others that might be representing that provider from the revenue side. So it could be a payer, could be a billing company, but enrollment in general, we like to think of it as getting the provider and the organization able to receive payment for the services that are rendered in the facility. And some of the characteristics of payer enrollment that make it unique and different in terms of challenges and how we look at it is that it's obvious time and resource consumer. It takes a lot of time and energy to do payer enrollment. It's something that is very highly variable across different payers and regions. And so there's certain markets you'll see where everybody does things the same way. Everybody uses CAQH. The process is somewhat universal. But then what we find in most markets is if you've got a payer and a process, you've got a payer and a process. The next payer is going to implement a different process or use a portal or use some other method for enrolling the providers into their health plan. So it's very highly variable. Also in markets like Southern California where we operate, you have a lot of intermediaries like medical groups and IPAs that are delegated and capitated by their health plans. And so you're having to enroll sometimes with both the health plan and with a network or a medical group in your region that's actually going to send business to your center. Another interesting thing about payer enrollment is that the payers themselves aren't necessarily motivated to make enrollment easier and to help you with that process and simplify it. Payers at the end of the day are processing claims and paying them. They operate in that mentality. And so, making it easier for a provider to get into their network, to bill for services, means that, they're having to pay for those services. And so most payers, either intentionally or unintentionally, probably unintentionally, devote most of their time and effort to payment processes, electronic remissions and funds transfers, claims payment, adjudication, reviewing codes, things like that. They don't spend a lot of time and effort on the front end, on the enrollment side. And I'd love to hear comments from any of you who work with payers directly on that. And I have some personal experience from many years ago operating with a medical group in Southern California on this subject. And then more importantly, enrollment mistakes like not enrolling the provider for the correct location where care is going to be provided can result in denials, delays, and downcoding of charges for services. So you might have a service that's totally legitimate, but if you didn't credential the provider to that location, you may get a denial saying, hey, we are not showing this provider active for this location. You may be able to recover that and rebill it and get the facility and the location added. But if you can do that as part of your enrollment process, initially, you're going to save a lot of time and energy. There are also some roles of third parties in the enrollment process. So I mentioned the IPAs and the groups here in Southern California. You see that in other markets where you might need to contract and enroll with health systems ACO, for instance, or clinically integrated network, or the hospital's PHO, or an independent group or IPA. There's also the CAQH. And so for most of our clients, we feel like the CAQH plays some role in their enrollment scenario, whether that's just maintaining data on the CAQH or actually enrolling their providers through the CAQH. And again, that can be market specific or dependent, and can be variable from payer to payer. So all this to say is that facility credentialing has traditionally been fairly simple from a workflow and process standpoint. It's fairly easy to know if you're following a Joint Commission or HHC guideline, what you're going to need to do. Payer enrollment doesn't, unfortunately, have that level of standardization, at least not right now. And maybe that will change over the next 5-10 years, but right now it's quite a bit of a challenge for our groups. And so in terms of our view as a information technology vendor and provider, solution provider, we're looking at ways that we can help you with your process, help you with the data, help you track what you're doing, interface with entities like the CAQH, and to reduce your overall burden. There's no magic bullet. Enrollment's not going away. We're not going to solve it, with the click of a button. And this is one area in which Silversheet does not provide services. So unlike our facility credentialing, where you can use our Silversheet professional services, we don't offer payer enrollment services at this time. It is something we've looked at. We have some partnerships with organizations that do it. And so we're assessing whether we should step in as a service provider, but at this point, we're looking at payer enrollment from the perspective of a software vendor. Hemant, I'll just ask if you want to participate at this time, anything you've learned from your discovery, working with our clients or looking at the industry, anything you'd like to add to that?
No, I think you're spot on, Mark. I think we are really looking to sort of get up investments in our enrollment product. I think we've come to a pretty good state where we are able to serve a number of use cases within the enrollment workflow. And I'm just excited to share some of the features that we are planning for in quarters 3 and 4 of this year. So hoping this will all come to fruition. Yeah.
Great. Thank you so much. Okay, let's go ahead and step into the demo. I'm going to just look at the chat to see if there is any information. Sarita asks if there is a number to dial in. And so, Hemant, if you wouldn't mind taking that.
Not at all.
There should be a dial-in number in the details, and you can get that to her. Thank you so much.
Sure.
Great. I'm going to go ahead and share my screen now. And we'll get started with our demo. So the first thing to note about payer enrollment is that whether you're a facility or an enterprise client, you can access payer enrollment. You can license payer enrollment from us and add it to your Silversheet account. And then most of the configuration and management occurs within the software. So there is a great deal of work that we have to do behind the scenes. You can start using the product fairly quickly with some initial training. In general, we would plan on setting up your initial payers and your initial billing entities, things like that we'll look at today. But for those of you who might not be familiar with Silversheet, Silversheet is a browser-based cloud-supported system. And so when any user logs into Silversheet, they're going to be authorized and provisioned for their particular facility or facilities. As you can see, I can drop down and view other entities. I'm going to start at the enterprise level today. because many of our clients will probably utilize an enterprise account because they'll be doing both facility credentialing for one or more facilities, in addition to payer enrollment for one or more medical groups and entities. So network management and payer enrollment can be found in two places, and you can get to the same place when you're working with individual providers in two different ways. You can go through the network management area that we'll take a look at in a moment, or you can go directly to individuals' records. So for individual providers, if you have payer enrollment turned on, you're going to see two areas that intentionally support this area. So the first is the contracts area, which we'll just touch on briefly. The second is the enrollment workflow. So we're going to focus today on the enrollment workflow because we think this has the most benefit to organizations and the ability to make a difference for you in terms of the amount of time you spend on this function. So in an enrollment workflow, you're going to start by choosing a new enrollment. You could call this anything you want. It could be initial, could be a re-credentialing enrollment. For the most part, you're going to need to enroll your providers or re-credential them every 3 years with payers. That's the payer standard. And for the enrollment workflow, we have a standard process in which you can identify which provider group you're enrolling the provider with. You might ask, why would I care? Wouldn't it be the same group every time? What we're finding is that many groups have more than one billing entity, depending on the type of business or line of business that they provide. Some organizations like telemedicine and others have multiple state medical groups for each state. Sometimes they have medical groups set up for individual client relationships that they have. So you may, in fact, have more than one provider group, and your provider may be providing services through more than one group. And it's nice to have the ability to keep that separate and to track that information. So I choose my provider group, and then a really important step is to choose the locations. And so in this case, I'm going to just choose one location for this provider, but that will determine what goes into the enrollment application when you see it later. And then we come to the next step, which is to choose our different payers. So I'm going to just choose two that we're familiar with here in the Southern California marketplace, an IPA and a payer called Blue Shield. Okay. Now, we have added to our library the forms for this particular set of payers, and you can see that some require more than one form. So it's not as easy as necessarily filling out just one form. In many cases, these entities have forms for different parts of the relationship, for EFT, electronic funds transfer, electronic remittance, and you have to fill out individual forms for all of that. And for demo purposes, I'm just going to choose one each for these two. And so in terms of the magic, if you will, this is where we're going to take all of your credentialing information that is already in the provider record and apply it or use it to populate a mapped application in Silversheet. I'll make this a little bit bigger. So you can see what we have here is a PDF that's been mapped to populate the most common and data that's in Silversheet. And the first thing to note about these applications in these forms is that they're quite lengthy. In many cases, they have their own attestation questions, things like that. And so in terms of what we can do for you, we can populate the forms with information that's in Silversheet. Our goal is to get, about 70% of the application filled out for you. But oftentimes there are going to be some areas that you need to enter information manually because it's not stored in Silversheet, or it's presented in such a way that we can't necessarily map it. That's not a problem. We give you a fillable PDF at the end of the process. So you'll be able to download this document, use it, share it with the provider, share it with another team member, and get the information complete on the form. So you can email it around. It's a document that can exist outside of Silversheet. And then when it's completed, you can upload it back into Silversheet and store it as a document of record. So in this case, we've mapped some information, and again, for demo purposes, this provider may not have all of her traditional provider information in Silversheet, but you can see that we'll map additional fields if they exist throughout the application. And then you can download it, as I mentioned, and just share it again via email. I'm going to just put it on my desktop. And we're doing these forms with the most common and popular forms. So, California, Oregon, Texas, others that have standard applications, you'll see those, but also for the most common payers, Blue Cross, CMS, others that are out there. And so at the end of the process, when you're ready and you have a complete document, you can then upload that updated form. And I'll just go back to my desktop, show you how it works. And that will replace the initial populated form that we provided to you as essentially a draft. And then after that process, you'll be able to do other things with this. So once you're done with completing the forms, you'll mark that complete. And then the next step in the process is to send the forms out if needed. This can be sent to the provider if you'd like, or if you want to email them directly to the payer from here. If the payer accepts these forms via email, you could send them to the payer right from this step. The final step is to finalize the enrollment. And so you might ask, a really good question is, hey, we see that you can send the enrollment application out, but we spend a lot of time after that, getting the information, tracking what's going on, things like that. And those are areas that are coming in Silversheet, the ability to track that information and what you're doing with it over time. And the first step will be present in the dashboard, which we'll look at in a moment. But the end of the process, you would mark this workflow as complete, and then you can upload any enrollment approval form. So if you've got a letter, an email, something like that, that you want to store in this workflow to essentially memorialize that you've enrolled the provider, it's successful, the payer has acknowledged it, you'll be able to come back here and review, send, share any of these forms, make sure that you did your job, that the payer acknowledged that your provider really is enrolled. So if you get any questions from the payer later on, you can say, here's my audit trail, here's where you said you added them to your network, but yet I still don't see them in your provider directory, things like that. So the payer enrollment workflow is designed primarily to populate those applications, and there'll be additional features around tasks and tracking coming. Now, the next thing I would like to show is the Enrollment Dashboard. And so if we have Silversheet clients, you're familiar probably with the Credentialing Dashboard. It's a similar concept for enrollment. So if you're using enrollment, you'll be able to track information about the individual provider, payer, which group, status, things like that. You can see you can update the status. And we've started to build out some of these tasks now around specific things, like we've sent the application to the provider, or the provider's completed, or it's been sent to the payer. And so you can start to update these individual tasks here on your dashboard. This will update the status each time you change it. If there is an owner of the process in the workflow, it'll note that. You can see we've got some here. And then there's a notes feature as well. So you can add a new note. Date time stamped. Also, you can download this roster and this dashboard as a CSV file, and that can be opened up in Excel, or you can share it, with others in your organization. You can also filter based on statuses. So if I just want to know which contracts or applications have been sent to payers, I can do that. I can look at it by payer, my provider groups, and my enrollment owners. I can also do a name search for individual providers. So if you're a larger organization with perhaps 200-300 providers, you might do a name search or an MPI search here. So for payer enrollment, those are the two primary features that support that process. And for some of our clients, that's all they need. They don't need to go further. But for many, they're going to want to use network management to bolster their ability to track what's going on over time and to understand the different relationships that they have between the individual payers and their provider groups, especially if they have one or more provider groups. In addition, we've added divisions and subdivisions because some of our clients have divisions and subdivisions that are either geographic or they're focused on different types of services. For instance, a telemedicine provider may have a neurology division. They may have, a division by specialty, or they may have a division by customer, like employers who contract with their service versus a payer. And so you can use divisions and subdivisions to categorize and organize the type of work you're doing. However, you're going to probably spend most of your time working with payers and your provider groups. So for payers, you'll be able to track the information. We'll help you get this information into Silversheet as part of our implementation. And then based on the divisions and subdivisions, you'll be able to track which entities down the road can actually work with this payer. Now, that's a nice feature because sometimes you're presented with a payer list, with 150, 200 payers, and you're wondering, well, which payers can I enroll this provider with for this, particular service? And so by building in this organization within Silversheet, we've done some of the work to reduce that amount of work and to allow you to organize and reduce errors. And so you're not enrolling with the wrong payer or with a payer who doesn't care about your provider. And then for your provider groups, you'll be able to manage more than one. And for your provider groups, they can be organized in many different ways. But for the most part, we think of this as being billing entity specific. So a tax ID or billing ID that is going to drive this process. And so I can manage information about the group. I can add their tax ID, their group NPI, and a DBA. And then more importantly, I can put all of the practice locations. This is an area of enrollment that really is underserved or overlooked. It's the locations in many cases that drive the enrollment process. For instance, in some of our markets, we know if you don't credential the location with the vendor or with the payer, you can't then enroll the provider. So you're going to get a rejection letter saying you're not credentialed for this location, so therefore we can't, enroll your provider. And so they have to start the process over and credential for the location. So for locations, you can track primary and additional offices. These are individual records and can be managed by your team. Billing and mailing addresses, if applicable, And then you're going to have your assigned providers. And adding a provider is fairly simple. The provider does need to be in Silversheet already. After that, you can add them to in any of your groups. And so if I want to add Dr. Bagassian, and then I'm going to be asked to choose a primary location. So I'll choose my Wilshire location. You can actually also manage hours of operation, both at the location level and specifically for the provider. And why that's important is that a lot of health plans have a directory accuracy initiative. A lot of this was started by Medicare, making sure that for Medicare and Medicaid beneficiaries with the Affordable Care Act, that the information that's in a provider directory is accurate. So if you say that this provider practices at this location, they really are going to be there. And more importantly, if you say they're there Monday, Wednesday, and Friday, they need to be there Monday, Wednesday, and Friday. And so various auditors will look at that, and they'll even call the office and say, is the provider there? And go back. And we have seen provider organizations pay some pretty stiff fines over the years for not having accurate information. So if you're not going to that extent, your payer may come at you. There's some of the contracts have fines built into them. I had one client in the past, very large network of providers, but their Blue Cross plan charged them over $1 million in fines because of the inaccuracy of the information that they were sending to them. So gives you a context that there are real dollars at risk around this. And then in addition to the providers, you can manage the individual payer contracts. So I can say for this particular division and subdivision, so in this case, I'm operating through an IPA, that I'm going to be able to enroll with these 6 payers. And so based on all of that, that provider will now have the ability to have a contracts profile. So I add that profile. I set up how they are working with us. Are they employed or are they contracted? Maybe they're employed full time. The group, when did they start with the group? The provider type, in this case, they're a specialist. What specialty? Well, let's just say anesthesia. And then some of these areas are less important for most groups, referral tiers, things like that, are more of an internal thing for some of the larger managed care groups that are out there. But you can also enroll them for a second specialty. So if they're dual boarded or have more than one specialty, you can do that. And then you do have to choose their primary location and their effective date. And then they're going to inherit that information here. Oh, looks like I haven't added payers here. So otherwise, you would see the list of payers, the 6 payers that were set up for them. Because we didn't set up effective dates, I think that's why they're probably not showing up. But you can see their primary location here. And again, all of this information is important for the enrollment process. The contracts card is really more for ongoing management of that information. So knowing when their recredentialing date is, knowing their effective date of their current contract, and knowing things like their health plan ID or provider ID can all be tracked in this area. Now, to finish up, we'll show some reports, but I did want to mention that payer enrollment and network management are independent of each other. So you don't necessarily need to go through all of the rigor of setting up the network management to be able to get a payer enrollment completed. You also don't necessarily need to go through a payer enrollment workflow because we have clients that are delegated by health plans, and all they need to do is produce documents and reports on a monthly basis back to the health plans. So I'm going to do a time check here. Hemantha, just want to check in with you. Are there any chat questions at this time, or can we move forward?
Why don't we take the questions slightly at the end? I have 2.
Okay, just
big
want to make
questions that
sure
can
we
be,
have enough
yeah.
time to answer them. If there were more than that,
Yeah.
looks like we'll be able to. I just have one last thing to show in our demo, which is the ability to report information. So obviously being able to track all this information and map these applications, track our tasks and when things are complete are important and worthy developments and achievements for us to be your partner on this. But many of our clients are going to need some level of reporting. And so we will complement the data management with reporting. We'll be able to deliver reports like this report. These reports will likely be produced by our data team and our content team, and they'll work with you to build them out, to make them unique and usable for you. We'll share them via an automated email based on your updating requirements. So if you need this weekly, monthly, for the most part, enrollment reports are done monthly. So we envision doing these monthly. But if you need to make changes, you'll contact your account manager with Silversheet, and they'll update this information so that we can modify the report and get it back to you. And so it'll be very simple reports like this, just knowing, who's in your network or which contracts do you participate with. So in this case, I'm just showing one health plan and one provider group, but this could be my group in Silversheet, North County Orthopedics, and this could be my HealthNet relationship, and these would be my providers that are enrolled under HealthNet. Just again, a very quick glimpse at who's enrolled currently with HealthNet. So you can get the idea that there could be multiple plans, multiple groups, different uses for this report over time. We'll continue to work with clients. This will be an area that's expanding. And so wanted to thank you for letting me share that with the group. I'm going to stop sharing and allow Kamath to step back in. Kamath, do you want me to share the PowerPoint as well?
Sure, Mark. Sounds good.
Great. Okay, hold on just a moment. Okay, go ahead. I'm going to catch up to you.
Awesome. Hey, Sarah. Hey, Nazrat. It's great to see you here. I know Nazrat has asked a question, so thank you for participating. So I believe that the next set is for me to talk about what's coming up in the future. This is something that we've been very actively working on and partnering with. So one of the things is the ability for us to integrate with CAQH, and um, beginning this month, we will see that a lot of our integrations will start to yield results, as in we will have a lot fewer fields for the provider to start filling compared to where we are today. So at the end of it, though, we expect that in the next 1.5, 2 months, we'll have close to maybe 100, 150 plus fields filled out. Now, the objective of that particular integration is so that we are able to pull down the information from CAQH for the providers that have a profile that will enable the speed to enrollment and speed to credentialing as well. So that's something that we're doing. And the next iteration of that is to get the documents as well taken down from CAQH and uploaded into the appropriate packets and places within Silversheet. So that's something that we have focused on. Now, I think just structuring my updates, the recent updates we've had is the Texas state application is up and running. This is more for the credentialing application and perhaps maybe relevant even in some cases where there is a payer who's asking for a state application. So there are a couple of enhancements that we are looking to make to the Texas state application so that we can download the entire packet versus individual documents. That's the planned enhancements that Mark mentioned it on. We've completed the COVID booster workflow and reporting, and we've kept it flexible such that any future booster requirements around COVID as mandated by the state or by the federal government can actually be done without any technology changes or any engineering involvement. So the product's flexible such that it can expand, and we have the ability to report it appropriately. And that particular reporting is existing within Silversheet today. We have the affiliation portal and the privileges portal both up and running. These are more internal efficiency tools. for our credential managers such that they don't need to look up anywhere else to understand what the privileges of a provider are, and maybe respond to affiliation requests from other facilities for a specific provider. The health documents updates are in place. We've had a little bit of friction in trying to exchange documents between the credential manager and the clinician. Now that workflow has been tweaked such that the entire workflow is enabled such that the document can be exchanged within Silversheet. You will not need to use emails, and you can communicate back and forth on a specific document till it's according to the credential manager's needs. So those are some of the recent updates. Again, the future updates are CAQH integration is going to be in place now. We will start the user acceptance testing as early as this week. We are likely to, pull in some of our clients to demonstrate to them the value of this one and see for themselves what it is and take feedback on how this particular newer feature can in fact be enhanced. So we're looking forward to that very much so. The enrollment dashboards are getting spruced up so that we can allow for better filtering such that the lists can be built out, which can translate to the enrollment managers being able to communicate more effectively with the payers on the calls, and then be able to take bulk actions. We are also exploring the direct connectivity with payers. That's something that I wanted to talk about when Mark asked me for industry updates. I've had trouble locating payers who are ready to sort of partner with us such that they can accept information directly through an API. Now, if there is any such intermediary, we are looking to integrate with them, trying to expand our CAQH partnership to see if we can get updates from the payers based on the payer enrollment connectivities that CAQH has built out, and see if we can translate those into payer updates within Silversheet. Network management reports is something that Mark showed. We want to sort of bring that in-house within Silversheet, so you don't need to have a different tool. And we are trying to expand the network management reporting in general, and also planning on automating the network management setup, which means that if you give us a CSV file, we are able to set up your provider groups and all the associated providers within that provider group. So some exciting updates coming along, recognizing that we are rapidly investing into payer enrollment, and we are working with our clients and partners to make sure that the product and the product roadmaps properly addressed in accordance to their needs. So
Thank you, Amanth. I think we have time to answer the questions here. I've been answering some of them in chat, but I do want to memorialize a few for purposes of our recorded video. So question was, when sending applications directly out of Silversheet to the payer, I guess, or to anybody, is it sent securely? So we don't send the application as a detachment. We do require the recipient to enter some identifying information, date of birth currently, to receive that. And then I think as a follow-up, someone mentioned that it goes into the provider account. So that's something we'll review, Amanth and I will review and get feedback to you on that. And maybe that's something that we can modify so it could be sent to anybody, not just the provider. The second question is, are network reports currently available in production? And if not, when will they be deployed? I'll let Hemant take that because I know we've been building some network management reports to deliver to clients, correct?
yes, so network management reports are available in a different data warehouse instance of ours. We have not yet marked out a date of when these should start appearing within Silversheet. Depending on some specific client asks, we will continue to serve that specific need, but when that will show up in Silversheet is to be decided. So I need to get back to you, to, to Sarah
Right.
and Nazareth and perhaps whoever else asked that with a specific date.
But I think for now, those reports would be
Yep.
delivered by one of our staff. Is that correct?
Yes, that's correct. So
Gotcha. Okay.
we have offline means of delivering that report, and I've seen that built out for some of our clients.
Great. Thank you so much, Amanth.
So I will answer are the report automation capabilities currently perhaps I need a little bit more context, and I will get in touch with Sarah via Mimi, and then also get that particular question clarified and send a response.
Definitely. I have a feeling is the delivery automated in such a way that
I see.
the client could determine, hey, I
Got
want this report sent weekly to this group of individuals. Probably that's what that's related to. So thank you for that question. We'll get back to you. I think we have a few more minutes, possibly to 50 past, to answer any other questions.
So the Sherry is asking a question. Mark, had you addressed it?
So yeah, Sherry asked a question. I think it was somewhat similar to the first question, which is if you were to send the
I see.
application to the payer, it looks like it is designed to, from the email that goes out, at least, to be sent directly to the provider. And so there may be language in that email or in that experience that is solely relative to the provider. So,
Yeah, Sherry,
so
that's great feedback. I'll take this out and see what needs to be done on this one. Yeah.
and I think we are looking long term, to bolster the communications aspects, being able to populate and send forms and documents generically throughout, through the system to anyone with an email address. And so whether it's, in the enrollment workflow or, through the communications tools that we deliver with Silversheet, those features will be coming. And so the next major development will be the interface with CAQH. I don't want to downplay that at all. I mean, Hemanth led a significant effort to establish a relationship directly with the CAQH. We were told for really years that we could not have a direct relationship with the CAQH. And thanks to Hemanth and his team, we were able to secure that relationship so that we can work directly with the CAQH database and their API. And so that's going to be a very important game changer for us, and just part of how we can deliver additional benefit. Some of the areas we've been asked about, just so we could alert you to that, is, hey, could I do my facility enrollment through Silversheet? So we've been asked that. We've looked at that. Right now, we want to stay focused on individual providers. That's where we feel the biggest gain is. But that there is certainly the concept of being able to store more information about facilities over time, possibly with the intent of being able to then populate a facility enrollment form. Because obviously all of our clients, regardless, have to enroll their facilities with different payers, with the state, et cetera. And so I think more to come on that, but right now, for the next year at least, or the remainder of this year, we'll be focused on individual provider enrollment. So we want to thank you for attending our webinar today. We appreciate all of the feedback and the great questions. Like I said at the beginning, this is really the introduction formally of payer enrollment. We've been working on it for quite a long time, but we feel like we're at a point now where new clients coming on understand the process, how we can deliver value. We've developed the implementation services around it and the support services. Those are certainly continuing to be enhanced. We're finding new areas every day in which we can deliver more value. So again, I think what you see with enrollment in 6 months will be much different, much more enhanced, even more seamless than it is now. And we look forward to your participation and partnership with that. So with that, I'll end and just mention that we do have a webinar planned in June. We're going to revisit application processing because there have been a lot of changes and enhancements into that area, some of which aren't necessarily apparent, some of which are very obvious. And we thought this is an area that really applies to everybody, every Silversheet client. And so we wanted to revisit application processing. And then in the fall, after the summer break, we'll be back in September, and we'll introduce provider evaluation and quality management. And we're very excited about that. So we look forward to more from you. Look for more emails, updates. Please help us make the product better, feedback, get in the feedback loop, take our surveys. And we look forward to working with you as Silversheet grows and as your businesses grow. Thank you so much. Have a great afternoon, and we'll talk to you soon.
Thank you all.